Sleep issues are really common in the menopause transition, and surveys suggest that around 60% of women will struggle with either getting to sleep or staying asleep. There are many reasons for this, some related to the menopause, some not related. There's a direct effect of changing and loss of hormones that can directly impact on sleep. And then also there are obviously menopause symptoms that can significantly impact. So hot flushes and night sweats are the most common, but it may also be that your bladder is affected. So you're having to get up to go to the loo more in the night. Some women tell me that they have aches and pains that can impact on sleep. Although if you are having joint aches, if you're having pains in your body that are affecting sleep, it's a good idea to talk to your GP before just putting those down to the menopause. There may be psychological symptoms that are impacting, so low mood, depression, anxiety, feelings of stress, all of which can worsen in the menopause transition. There may be stress itself. There may be what's going on at home, within family, and what's going on at work that's also having an impact on sleep. And there are some medical conditions, there are some medical sleep disorders that can worsen in the menopause. So, for example, sleep apnea and restless legs. And they're not related to the menopause. There are medical conditions that can impact on sleep, for example, chronic pain, and some medication also can impact on sleep. There are lots of different ways to help manage sleep. If it's menopause symptoms that are keeping you awake, then hormone replacement therapy, or HRT, is the most effective way for most women of managing those symptoms. So if it's night sweats that are keeping you awake, starting HRT, or if you're on HRT, you maybe need to change your dose, can be really helpful. So that's something to talk to your healthcare professional or GP about. If you don't want to take HRT or you've been advised not to, there is medication that can be used as an alternative. For example, most of the commonly prescribed antidepressants can help take the edge off hot flushes, and there is evidence to show that they can help sleep. There are lifestyle changes that you can make that can have a positive impact. Avoiding caffeine is really important because caffeine is a stimulant and it lingers in your body for many hours. And so avoiding caffeine after lunchtime can be a helpful step that you can take. Avoiding alcohol is really important because although it's really tempting to reach for a glass of something to help you get off to sleep, the quality of sleep that you have may be a lot poorer, so you just don't stay asleep and you're waking up in the middle of the night again, and this can feel really grim. So avoiding alcohol is a really good step to take. Exercise has been shown to help manage sleep, so particularly vigorous exercise, but also exercise like yoga, practicing meditation, learning good breathing techniques can be a really good way of switching off and relaxing before you go to bed. Yoga is also one really good way of managing stress. If it's stress and ruminating about what's going on in your life, etc., then yoga, again, breathing techniques, meditation is a helpful way of helping to manage those unhelpful thoughts. Good sleep hygiene is really important. And this is all about setting yourself up at bedtime into a good routine so you're ready to go to sleep when you get into bed. So this is about relaxing before you go to sleep, relaxing before you go to bed, whether it's reading a book, listening to music, having a bath, whatever it is that's helpful for you. It's important that your room is dark and cool. I know it sounds obvious, but again, it's setting up your body in preparation for the nighttime, for sleep. If you're sweating a lot in the night, then looking at cotton nightwear and cotton sheets can be a helpful way to help manage those hot sweats and keeping you cool. Many people will tell me that they put their pillow in a freezer before they go to bed, so they've got something cool to lay their head on. They may keep a towel by the bed or change of bedclothes by the bed. So if you do wake being wet, being drenched in the night because of sweat, you've got something easily accessible that you can quickly change without even fully waking up. If you do wake in the night spontaneously, and it's really common to wake between 3 and 4 a.m. in the morning, then there's evidence to suggest that you shouldn't lie in bed awake for too long a time. So if it's getting to 15 minutes, 20 minutes, it's better to get up, have a decaffeinated drink, and then go back to bed. Many people tell me they find it helpful if they listen to some music or an audiobook, the radio, they read for a little while. Again, if they wake in the middle of the night and then then they're able to go back to sleep rather than lying there ruminating on the impact of the next day if you really can't sleep. There's good evidence that cognitive behavioral therapy can be helpful, and this is all about challenging the vicious cycles that can get set up where you may wake up in the night or you may find it difficult to get to sleep, and then you're worrying that you're not going to get enough sleep. You're worrying about the impact on the loss of sleep on the next day. So cognitive behavioral therapy is available obviously as a one-on-one, as group therapy, but there are also books about it, and there are lots of apps out there. And we've got information in the pause.community part of our website that talks about apps that can be helpful for sleep. Alternative therapies can be helpful for some also, and there's good evidence that hypnotherapy and hypnosis can help. It may be that there's a recording that you can download or one-on-one sessions that again can help teach techniques into relaxation and switching your brain off, particularly if you're waking in the middle of the night. If it's medical conditions that are keeping you awake, particularly if it's sleep apnea, if it's restless legs, then please do speak to a healthcare professional, speak to your GP, because there will be therapies that can be helpful if it's medication or other medical conditions that are keeping you awake. Then again, seeking help can really help get you off to sleep, can help you staying asleep with a positive impact on your quality of life. If it's a medical condition that is impacting on your ability to sleep or stay asleep, then obviously please seek help through a healthcare professional or through your GP. There are ways of managing sleep apnea, there are ways of managing restless legs. Both of those can worsen in the menopause transition. But if it's other medical conditions, then obviously seeking help for that can be helpful. So sleep is really important for all of us. It's important for our mental well-being. It's actually also important for our physical well-being. And if sleep issues are having an impact on you, please seek help. Talk to your doctor, other care health professional, talk to a menopause specialist if it's related to the menopause, because there are many ways that we will be able to help you.